Hello people, in this video let us look at all the causes of diabetes mellitus, okay? So all of them. So based on the classification itself we will learn now, okay? So etiological classification of diabetes mellitus, that means by the cause, right? So first of all you have type 1 diabetes and then you have type 2 diabetes, right? This you would have already heard. And then you have other specific types of diabetes mellitus. In this you will come to MODY, that is maturity onset diabetes mellitus, okay? So maturity onset diabetes mellitus, diabetes of the young, this one MODY, is not type 1 or type 2, okay? So we will come to that. Then you have defects in insulin action. So insulin is there, it's not able to act, so that is a separate thing, again genetic. Then pancreatic disease, pancreas itself has some problem, like there is no pancreas at all, so there is a pancreatectomy that has been done, so there's no pancreas at all, or the pancreas has some cancer or something, so that becomes another. And then you have the some antagonist to insulin is being produced in the body. So insulin is there, but there is something that is not allowing it to work, okay? So something that is acting against the insulin, that could be growth hormone or excess steroids or some glucagon. Glucagon is the opposite of insulin, that you know. Then catecholamines or thyroid hormone. So these could be one reason. Then you have drug induced, because some drugs that person is taking, he's having excess glucose, right? So he's having diabetes mellitus. Associated with genetic syndromes, like some other syndromes it's associated with, and then gestational diabetes, that is in pregnancy. So basically this is the overall classification, people. Now let us look at each one of this a little more in detail, okay? So what and all have you learned so far? There are many types of diabetes mellitus based on the cause. Let's start with type 1 now. What do you mean by type 1? How will you say I am type 1 and you are type 2? Okay, so now let us get to that. Type 1 diabetes means what? Means there is some autoimmune condition. What is there? Autoimmune condition. Autoimmune, like the T cells, these T cells which are nothing but what? Some white blood cells, right? The T lymphocytes. They are causing some beta cell destruction. Destruction is the word that you have to write. The beta cells are less in number in the pancreas. There is destruction of the beta cells. By whom? By the T cells. So this is autoimmune. Your body itself is destroying your pancreatic cells. Correct? So this is, you will be able to detect the autoantibodies in these people. So here what will happen? Beta cells are not there. Means what will be there? Insulin deficiency. The word you will write is deficiency. What will you write? Deficiency. That is insulin deficiency. That is beta cell destruction, autoimmune. These are the words that have to come out if they ask for what is type 1 diabetes. Okay. Now, type 2 diabetes. Now we are moving on to what, people? Type 2. Okay, type 2. Now what is type 2? Type 2 mostly you would have seen in our parents, etc. So that is where there is beta cells are there, but they are dysfunctional. That means they are not working properly. Okay, there is nothing autoimmune in this condition. Okay, so beta cell dysfunction is there, because of which what will happen, there is insulin deficiency can be there, okay, to some extent it can be there, but mainly what is there is insulin resistance. It's not that it's mainly, but basically there is beta cell dysfunction, insulin resistance combined with insulin deficiency combined with insulin resistance. This is what is type 2 diabetes. So now what is common between these two? Genes and environment, okay, both are kind of common. When we read the definition, both they say they are kind of genetic, and some environmental trigger can be there. Okay, now what are these environmental triggers? Do you know why? What are these environmental triggers? Especially in type 1 diabetes, they are genetically susceptible, to which this environmental trigger will come and cause them to start attacking their own pancreas. What are those triggers? Do you know those triggers? I will list them here. There can be some virus like Coxsackie virus, coronavirus, that is their COVID virus. Okay, then you can have toxins. Toxins can be something like nitrosamines. Some person is giving a very young infant, a very early infancy, that if that baby has been given cow's milk, that can be a trigger, they are saying. And then there can be some, what else? Vitamin D deficiency also. Vitamin D deficiency. Then one more is there here, I forgot, wait. Hygiene, okay, we'll make this H. Just put an undo here, yeah, H, hygiene. So these are the environmental triggers that can lead to that genetically predisposed person to develop type 1 diabetes mellitus. Okay. So you got it, people. So where are we here? So type 1 is what? Now type 1 you will say. Very easy. Type 1 is genetically predisposed with some environmental trigger like these 4. This will lead to some autoimmune condition in these people, which will attack that T cells will go and attack the beta cells of the pancreas. That will cause beta cell destruction. That's why there is going to be you will detect auto antibodies in these people. There is going to be insulin deficiency. So these people will have to take insulin. Correct? All of you understood. Very good. Now coming to type 2 diabetes. Can you explain type 2 diabetes? Yes, sir. Type 2 diabetes also is kind of genetically predisposed and later it can be acquired by this person. What exactly is happening is that there is beta cell dysfunction. The beta cells are not functioning properly. This is commonly associated with obesity, or in the elderly we can see this, like our parents especially. So then there will be insulin resistance in combination with insulin deficiency, to whichever can be more. Either deficiency can be more or resistance can be more, or combination like that. Okay, you understood. So what are the unique words, people? I'm telling again, I'm telling you again because type 1, type 2 is so difficult to write this definition, right? Type 1, autoimmune, beta cell destruction, autoantibodies will be there in these people, deficiency of insulin. Type 2, beta cell dysfunction, it is associated with obesity, and or in the elderly there will be insulin resistance combined with insulin deficiency. Okay, got it? Very good. Did you notice there's one star there, people? Here, after type 1 and type 2. So there is some blend of both also that they are writing here. I will show you that. The star means the WHO recognizes there is some hybrid form of diabetes. Okay. Slowly evolving immune mediated diabetes of adults. So I'm thinking that there are two here. The slowly evolving immune mediated diabetes of adults, and there's one more called as ketosis prone type 2 diabetes. These two are recognized as hybrid forms of diabetes. Okay, if you understood anything, good, otherwise don't break your head too much. So okay, there is some hybrid of these two also, looks like. Okay, now let's get back to our main topic here, other specific types. Shall we go to other specific types now, people? Okay, good. So other specific types of diabetes, you have the genetic defects of beta cell function, MODY. Here, genetic, nothing autoimmune they are saying. Remember, it is genetic. MODY, maturity onset diabetes of young. So beta cell function, this is genetic. They are saying which genes also, I will tell you. Wait. See, MODY, how many types are there? 1, 2, 3 and 5. I can see type 1, 2, 3 and 5. I can see MODY. What is MODY? Maturity onset diabetes of the young. Okay. This is also type of diabetes mellitus. It is monogenic diabetes mellitus, means single gene, right? And what is the gene mutated? GCK and HNF. Okay. What exactly is happening if GCK is affected? Beta cell cannot sense the glucose, looks like. Okay. And HNF means beta cell transcriptional regulation has some functional defect. So here some transcription has regulation has some problem. Here glucose sensing. If it doesn't sense glucose, then why will it make insulin, right? So read all the details here, people, and you can understand more about MODY, which is a type of diabetes. What I'm understanding is this guy is very lucky. Okay. His HbA1c is also normal, and his treatment also he doesn't need. Okay. His HbA1c will be normal, but then what is the problem here? Doesn't look so problematic at all to me. Then coming to the second one here, MODY 351. What happens here? This is adolescence. Okay. This diabetes develops in adolescence, early adulthood. Okay. And this also can be managed with diet and tablets. And then late after that, you will need insulin treatment. Okay. Well, there's a lot to read here. It will lead to renal failure, etc. That and all you can read. But here, are we here to learn more about MODY? No, we are here only to learn the causes of what? Causes of what? Of diabetes mellitus. Very good. And we are learning the etiological classification of diabetes. Okay, then you have genetic defects of insulin action. Lipodystrophy. So if they have some lipodystrophy, they can have defect of insulin action, which they are not considering in type 1 or type 2. See, type 1 or type 2 or MODY, everywhere there is less insulin. That's what I'm understanding, right? But here, what less insulin or insulin resistance or something like that. But here they are saying insulin action has problem. This is not a resistance, but looks like. Okay, people. So there is one other thing. But there is insulin action will not act because of some genetic cause. It's not insulin resistance. Okay, something else they're saying. Genetic defects of insulin action. It cannot act. Then pancreatic disease, we told you pancreatic disease. Pancreas has some problem. What problem does the pancreas have? Let us ask the pancreas. Pancreas, dear pancreas, what problem do you have? The pancreas is crying and it is saying, I have pancreatitis. They have removed the part of this pancreatectomy. There's no pancreas at all. There is some neoplasm in the pancreas. Neoplasm is there in the pancreas. There's some cystic fibrosis, hemochromatosis, that is iron deposit is more. Then there is some fibrocalculus in the pancreas. There is some fibrocalculus. So all these are the fibrocalculus. I'm just putting something here. A lot of fibrosis. What is that? Fibrocalculus pancreatopathy. Okay. So the pancreas is crying. So this is another cause of diabetes mellitus. See, they're not blaming the beta cells exactly. The entire pancreas they are blaming. Got it? Got it? So this is another type of diabetes mellitus according to them. Okay. Do you know that there is a diabetes mellitus and diabetes insipidus is separate? So you have diabetes mellitus, then you have another condition called as diabetes insipidus. Here we are talking about diabetes mellitus, all the etiological classification. Okay, people? Very good. Now, next we're going to this point. Are you ready? Excess endogenous production of hormonal antagonists to insulin. So insulin is there again. There is some hormonal antagonists. Hormonal, very specifically they're telling you it's a hormonal antagonist to insulin. Okay. So which hormones are antagonists to insulin? I will say first of all glucagon. Who won't say this word? Steroids. Okay. Growth hormone. Catecholamines like in pheochromocytoma. Thyroid hormones itself. Thyrotoxicosis. So these won't let the insulin act. Okay. Excess production of these hormones won't allow insulin to act. So this is a separate entity of diabetes. Okay, people? Okay. Because these are all some higher levels of things. Okay. It is beyond the pancreas. Something like that. Okay. That's what I'm understanding. But glucagon comes from where? Pancreas only, I thought. Who makes glucagon? Just check and tell. It's actually made by the alpha cells of the pancreas itself. Okay. Then drug induced. Now next level we are going. Some drugs, that means medicines this person is taking, so there's problem, so he has diabetes, like steroids he's taking, glucocorticoids, thiazide diuretics he's taking. So if you take diuretics, there's problem, is it? HIV drugs, that is retroviral drugs if he's taking. Immune checkpoint inhibitors, this is some cancer therapy, right? So this also if they are taking. So all this can cause what, people? People, what are we talking about? Types of diabetes mellitus based on the cause. Now what are we looking at? Drug induced. That means this person has taken some drugs. Which drugs are they talking about? Cancer drugs, HIV drugs, steroids they are taking. Then what else you saw? What else we saw? What else we saw? We saw, okay, thiazide diuretics. I didn't know that diuretics will cause this problem. Okay. Then we are going to the last 2 points. People, only last 2 points. Speak up. Associated with genetic syndrome. So they have some other syndrome because of which they have diabetes. Down syndrome. It's not Downs. It's Down syndrome. Klinefelter syndrome. That is XXY. Then Turner syndrome. X0. Didmod. Didmod is diabetes insipidus, diabetes mellitus, some optic atrophy, I think. Then D. What is this? This is Wolfram syndrome. The D is actually deafness. Okay, nerve deafness. Nerve is the problem. Okay. So, diabetes insipidus, diabetes mellitus, optic atrophy, nerve deafness. This is Wolfram. Am I saying it right? Wolf has deafness. So, that's how you will remember. But this sounds more like a toad to me, not like a wolf. Mode. MOAD. Didmod. DMAOD. Okay. Then, Friedreich's ataxia. What is that disease? Fried rice kind of a thing. Friedreich's ataxia. So this is ataxia and all. No? So this person actually have nerves issue he has. You can read more about that, people. Then myotonic dystrophy. So some muscular problem, dystrophy. Okay. So some high level diseases which are causing excess glucose, I'm thinking, right? Or, yeah. Okay. So that is another classification. There's some other completely different disease in that person. Okay. Gestational diabetes, pregnancy. In pregnancy, what exactly happened, people? The pregnancy hormones, what they are doing, they are making the insulinase become more. So insulinase will become so much high. Let's use this color. Okay. In pregnancy, insulinase becomes so high. So what will happen? Insulin gets destroyed. It will go and destroy insulin. So that lady who's pregnant, she will develop diabetes. Okay. Gestational diabetes. Got it, people? So people, let's revise etiological classification of diabetes mellitus. Type 1 diabetes mellitus, autoimmune, beta cell destruction, insulin deficiency, autoantibodies. Type 2 diabetes, it is beta cell dysfunction seen in obesity or elderly, insulin resistance with insulin deficiency. Then you have hybrid between these two, that is type 1 and type 2 hybrid can be there. That name is something immune mediated, another is ketosis prone. Okay, these are hybrid. Then you have the other specific types of diabetes mellitus where you have the MODY, maturity onset diabetes of young, where you have the problem with the gene, single gene, monogenic they are saying. So then that is not much of a problem. Later some of these can become a problem though. Then you have insulin action cannot act because of some genetic defect like lipodystrophies. Pancreatic diseases, people. The pancreas itself has problem. Pancreatitis, pancreatectomy, neoplastic disease, cystic fibrosis, hemochromatosis, that is iron deposit, fibrocalculus, pancreatopathy, that is there's some fibrous tissue or some stones, calculus, right, in the pancreas. Then some hormones are there which are acting against the insulin, like growth hormone or steroids or glucagon or catecholamines or thyroid hormones. Okay, then drug induced, some drugs this person is taking which is causing the problem, that is steroids, that is glucocorticoids, thiazide diuretics, HIV drugs, some cancer drugs, etc. Then he has some genetic syndromes because of which he has diabetes, like Down syndrome, Klinefelter syndrome, Turner syndrome, add, that is Wolfram syndrome, that is diabetes insipidus, diabetes mellitus, optic atrophy, deafness, then Friedreich ataxia, that is some problem with the nerves, then myotonic dystrophy, gestational diabetes and pregnancy because of insulinase enzyme being more. So these are the other specific types of diabetes mellitus. If somebody in the exam asks you other types of diabetes mellitus other than type 1 and type 2, you will have to list these. Okay, bye bye.